Today, I would like to discuss something that plagues almost every pregnant woman that I see in my office, and that is back pain. I'm going to discuss the physiology of why so many people experience back pain in pregnancy, and I'm also going to talk about some solutions to help resolve or at least improve it. Hello, and welcome to the Midwife Says, where I share evidence-based facts about women's health, pregnancy, birth, and postpartum. My name is Melanie, and I am almost a licensed midwife in the state of Florida. We know that back pain is not unique to pregnancy. However, pregnancy creates a lot of strain on the back and therefore back pain, especially for anybody who already has pre-existing back pain. So why is that exactly? During pregnancy, we have a hormone called relaxin flowing through our body. This hormone is extremely important. It helps loosen all of our joints and ligaments to aid in an easier birth. And while this hormone is extremely helpful and important, the downside is that the joints of our pelvis are significantly more prone to movement that results in pain. In combination of the hormone relaxin, we also have a growing uterus. Inside the uterus, we have a baby, a placenta, and amniotic fluid. As the weight of the pregnancy increases, so does the increase in pressure on the body and mainly the back. The hot spot for pain in pregnancy is usually the lower back or sacral area. This is largely due to the ligament called the broad ligament. You may have heard of round ligament pain. If you have not, or if you're interested in hearing more about that, you can click this little box up here to see my video on that. But we have another set of ligaments that participate in anchoring the uterus to the pelvis, and that is the broad ligament. It wraps around the uterus and attaches to the sacrum. It is responsible for stabilizing the uterus from front to back motions, while the round ligament is responsible for stabilizing the uterus in side to side motions. Unlike the round ligament, which have the most amount of tension when people are changing positions, like getting in and out of bed, reaching for something, really doing anything one-sided, the broad ligament is maxed out on tension all the time. The ligament is huge, so the amount of strain it puts on the sacrum is also very great. If you're someone with pre-existing back pain coming into pregnancy, you may notice no difference because you're used to this discomfort, or you may notice even more back pain than you normally have. Oftentimes in pregnancy, our weak spots show up. Our body is in a state of decreased immune function, and by the end of our pregnancy, our body has been pushed to the level of an Olympian. So any pre-existing injuries or pain points you have are generally exacerbated in pregnancy. So what can you do? Well, hang on with me because I have 4 tips that may just help get rid of this pesky back pain so that you can have the pregnancy you dream of. Number 1 is a belly band. Belly bands are a huge aid in pregnancy because they help take some of the weight off the pelvis. This can help relieve not only back pain, but also round ligament pain, and anyone who is dealing with symphysis pubis dysfunction, or also called lightning crotch. I'll do a video on that in the future. Belly bands are truly a great asset and can completely change your pregnancy for anywhere from $20 to $50. I'm not partnering with these brands on this video, but I'll link my belly bands that I've seen and clients have a lot of success with in the description box below. Number 2 is a chiropractor. For those of you that have been to a chiropractor, you already know. For those of you that have never been or are not sure what a chiropractor is, let me try to explain. A chiropractor is a doctor who specializes in aligning our skeletal system and muscle system and correcting any problems related to that. If you're a chiropractor watching this video, please feel free to leave a comment with your own description of your profession in the comments. I'm doing my best to explain here. They do this by a series of movements with the body, and you can look up some videos on what chiropractic adjustments look like. In pregnancy, techniques are usually much more gentle and modified to the pregnant body. Chiropractic care in pregnancy is highly recommended as our bodies are undergoing an enormous amount of strain in combination with the hormone that we talked about earlier called relaxin. Chiropractic care in pregnancy helps offset some of the strain your body is going through and keep things in their proper position so that you don't have to feel any more discomfort than what is normal in pregnancy. Number 3, exercising your back. This may seem counterintuitive to put more strain on the back when your back is already uncomfortable, but here's why. Strengthening our muscles helps keep our body protected against injury. And as your muscles grow in density, your bones grow in density as well. Having a strong structure in the muscles of your back can decrease your risk of injury due to something silly like getting out of bed. Be sure to follow back exercises that are safe for pregnancy, and when it comes to exercising the back, especially in pregnancy, take it easy. Finally, number 4, support while you sleep. Sleep can be a really challenging thing to conquer in pregnancy. And part of that is normal due to our hormones and all the wonderful things that are supposed to be happening in pregnancy. But sometimes back pain contributes to a lack of sleep, and let's try to avoid that if we can. Some back pain while you sleep is unavoidable. There's a great deal of pressure on your pelvis and your hips and your lower back, depending on the position that you're sleeping in. You can use pregnancy pillows, regular pillows, or even pool noodles to support your body while you sleep. If you're a side sleeper, putting a pillow underneath your back, underneath your belly, and in between your legs can really support your skeletal structure and reduce strain that's being put on your back while you're sleeping. Don't forget to support your belly, because a strain on the broad ligament from your hanging belly will create strain on the back. I'll link a couple of pregnancy pillows that I've heard great things about in the description box below. I genuinely hope that these tips can help you. Pregnancy should be a time of joy and comfort, and it is a phase of optimal health. If you have any further questions, or you would like a video that goes in more detail on this subject, or as always, if you have any other topics you want discussed, please let me know in the comments down below. I hope that I can earn your subscription, and if you found this video valuable, please like and share with a friend. That lets YouTube know that this is important and valuable information and will recommend this video to other people like you. Thank you so much for watching. Take care of yourselves, and I'll see you next time.